Bismillahirrahmanirrahim. Today we will discuss membrane potential, and membrane potential is the difference in total charge between the inside and outside of the cell. It's called the membrane potential. This is the difference. This is the outside of the membrane and this is the inside of the membrane, cell membrane. So the difference between the inside negativity and outside positivity, this difference is called the membrane potential. A membrane potential arises when there is a difference in the electrical charge on the two sides of a membrane due to a slight excess of positive ion or negative ion on one side and a slight difference on the other side. The change is slight. There is positive charge outside or in the extracellular fluid and negative charge inside or in the intracellular fluid, and this difference in the charge is called membrane potential. Such charge difference result by active electrogenic form. We know that the same charges attract each other. The positive attract the negative and the negative attract the positive, and the same charges repel each other. So the tendency is that inside the membrane is negative charge. The intracellular fluid is negatively charged and the extracellular fluid is positive charge. So this difference is brought about by pumps, and these pumps are called electrogenic pumps. Resting membrane potential. All cells under resting condition have an electrical potential difference across the plasma membrane such that the inside of the cell is negatively charged with respect to the outside. Here you can see that the inside is negatively charged and the outside is positively charged. Its magnitude depends on the type of cell, but usually range between -70 and -90 millivolt. Magnitude or quantity of the charge depend on the type of cell. In various types of cell, this magnitude or quantity is different, but most of the books are agree upon from -70 to -90 millivolt. And normal value of resting membrane potential in different cells, or that in skeletal muscle it is 90, in smooth muscle it is -60 millivolt, in choric muscle it is -85 to -90 millivolt, and in nerve cell it is -70. So it is between -70 and -90. The rest membrane potential is between -70 and -90 millivolt. Factor contributing to this membrane potential. What are the factors which cause this membrane potential? Two ions are responsible, sodium and potassium. An unequal distribution of these two ions occur on the two sides of nerve cell membrane because carrier actually transport these two ions. Remember, the resting membrane potential is present in all cells, and the action potential occur only in nerve and muscle cell. So for the resting membrane potential, two ions are responsible. One is the sodium and the other is the potassium, and they are unequally distributed across the cell membrane. This is cell membrane, is the inside of the cell, and outside of the cell are extracellular and intracellular fluid. So these ions are unequally distributed across this cell membrane. Sodium from the outside to the inside and potassium from the outside to the inside. As a result of active transport mechanism commonly referred to as the sodium-potassium pump, there is a higher concentration of sodium on the outside than the inside, and a higher concentration of potassium on the inside than the outside. The sodium-potassium pump has higher concentration of potassium inside and higher concentration of sodium ion outside of the cell membrane. Ion concentration inside and outside of the neuron. The resting membrane potential is a result of different concentration inside and outside of the cell. The difference in the number of positively charged potassium ion inside and outside the cell dominate the resting membrane potential. Here you can see that sodium outside is 145 millivolt and inside it is 12 millivolt. Potassium is 4 outside and 155 inside, and chlorine 120 outside and 4 inside. So due to this difference, the resting membrane potential is acquired. Multiple factors are involved in this mechanism. Ionic channels. These ionic channels are divided into three super families. One is voltage gated, the other is ligand gated. This is the voltage gated channel, this is the ligand gated channel, and mechanosensitive ion channel, which actually responds to mechanical change in the environment, and sodium and potassium channel. Here you can see that the voltage gate channel, when there is different gradient of the ions across the cell membrane, these channels either open or close. Their response to the potential gradient, different potential gradient across the cell membrane. With their difference in the potential, ionic gradient or ionic concentration cause opening or closing of these channels. The ligand gate channel actually responds to a ligand or neurotransmitter. They have a receptor on their surface for these ligands, and when these ligands attach to these receptors, these channels open and allow the movement of ions across the cell membrane. And the third one is the sodium potassium channel. This channel play a major role in retaining the resting membrane potential. This is also called ATPase channel because it uses ATP, adenosine triphosphate, for its activity. And when this channel is, ATP is added to this channel, it gains energy. 3 sodiums are attached to this channel, and these ions are taken out from the intracellular fluid to the extracellular fluid. And 2 potassium ions actually attach to these channel, and they are taken inside the cell. Here you can see that 3 sodium channels are taking away or bringing out of the intracellular fluid, and 2 potassium ions are bring inside the cell membrane or into the intracellular fluid. Voltage gated ion channels. Voltage gated ion channels are highly selective for a specific ion. For example, sodium, potassium, calcium, and chloride. The voltage gated ion channels are function through the mechanism of membrane potential. If a cell membrane has ionic channel for sodium, so this channel only allow the transport of sodium across the cell membrane. Membrane has chloride channel. This channel is only allow the chloride ions across the cell membrane. It doesn't allow any other ion across the cell membrane, and they act at different time and with different action. Voltage gated sodium channels are responsible for generation of action potential of long duration. They are target of local anesthetics such as lidocaine and benzocaine. Lidocaine and benzocaine are local anesthetic. These are used in minor operative procedures, and they are given locally. These lignocaine and benzocaine anesthetic block the sodium channel for longer duration, and we can perform a minor surgical procedure in that area where this drug is injected. Voltage gated calcium channels and action potential. These channels, when the action potential propagate along the axon and when the action potential reach the presynaptic terminal, their calcium channels and regulate calcium concentration and test are responsible for wide range of biochemical processes within the cell. One of the most important processes regulated by these channels is the release of neurotransmitters at synapse. Calcium channel blockers are valuable in the treating a variety of conditions ranging from heart disease to anxiety disorder. We know that these channels are present in the terminal presynaptic neuronal membrane, and when the action potential arises at this site, these channels open and they allow the calcium influx inside the neuronal membrane. When the calcium influx occurs, this causes vesicles which contain synaptobrevin receptor on its surface and syntaxin receptor on the presynaptic membrane. These two receptors are activated by the calcium, and they bring these two receptors join together and bring the vesicle end of the membrane of the terminal neuron, and in this way they release their neurotransmitter into the synaptic cleft. Voltage gate potassium and chloride channels. Voltage gate potassium channels contribute the largest and the most diverse class of voltage gate ion channels. They are imperative in generating the resting membrane potential. They are most important in generating the resting membrane potential. Voltage gated chloride channel. These channels are present in every type of neuron and are involved in regulating excitability and cell volume. They are also known to contribute to resting membrane potential. So all these voltage gated channels, either potassium or chlorine, they are responsible for maintaining of the resting membrane potential. Mechanism by which these channels restore the resting membrane potential between -70 and -90 millivolts. So sodium and potassium, ATPase or sodium potassium pump. One of the mechanism is by sodium potassium pump. The other mechanism is potassium leaky channel. They play important role in maintaining of the resting membrane potential, and the third one is sodium leaky channel. When action potential occur, this is the extracellular fluid, and we know that it contains more sodium, and this is the intracellular fluid or cytosol, which contains more potassium. When action potential is produced, the sodium rush into the inside of the cell, and it cause or reduce the negativity of the cytosol or the intracellular fluid to more positively, or increase the positivity of the intracellular fluid. Due to this increased positivity, it's called depolarization. And when there is increased positivity inside, we also have potassium inside, which carry the positive charge. So on the cell membrane we have potassium leaky channels. Through these channels, the potassium move outside from the intracellular fluid to the extracellular fluid. So by this way, the positivity of inside of the cell is again bring back to the negativity. The second mechanism and the most important mechanism is sodium potassium pump. This pump removes the rush of sodium or the influx of sodium which occur during potential to the inside of the cell. Sodium is then removed by the sodium potassium pump from the interior of the cell, and this is an energy dependent channel at ATP, and it removes 3 sodium ion from the intracellular fluid and then bring 2 potassium ion inside the cell or into the intracellular fluid. So you can see that 2 potassiums are coming in and 3 sodium are leaving the intracellular fluid. By this mechanism, the inside positivity is only bring to minus 5 millivolt. It's play only minus 5 millivolt, the role of minus 5 millivolt. The other mechanism is potassium leaky channel. When the sodium influx occur inside the cell, so the negativity is then converted to positivity. So the potassium, this is a leaky potassium channel, and it allow leakage of potassium from intracellular fluid to the extracellular fluid. This movement of potassium from inside to the outside bring the inside negativity to minus 90. This is because when the potassium leave inside the intracellular fluid, the potassium attached to an ion, negatively charged ion, and these negatively charged ion phosphate and protein. These proteins and phosphates are large and they can pass through these leaky channels, so they are left behind and potassium leave the cell. Due to this, these negatively charged ions, the inside of the cell is become negative. When this negativity by the potassium leaky channel, the negativity is bring up to minus 90 millivolt. It is because the potassium channel close a bit later than the sodium channel, and still there is efflux of the potassium outside cell, and this increase efflux of potassium cause hyperpolarization. When this hyperpolarization of minus 90 occur, to bring this minus 90 to minus 70, we have another channel on the cell membrane, sodium leaky channel. When the potassium leave more from the intracellular fluid, sodium leaky channel allows sodium influx inside the cell and bring the intracellular negativity from minus 90 to minus 70. These are the 3 channels which play. One is the sodium leaky channel, the other is the potassium leaky channel, and the third one is the sodium and potassium pump. By sodium leaky channel, sodium influx occur into the intracellular fluid. By potassium leaky channel, potassium efflux the inside of the cell to the extracellular fluid, and by sodium potassium pump, 3 sodiums are taken out from the intracellular fluid to the extracellular fluid and 2 potassium are bring inside. So when this pump, the sodium potassium pump, if it operate 100 times, so it will bring 300 sodium outside of the intracellular fluid and will bring 2 potassium inside the intracellular fluid from the extracellular phase. All these channels play their role, and if I will put all these channels together, so the sodium potassium pump bring the negativity up to 5 millivolt. The potassium leaky channel bring the negativity when combined with the sodium potassium channel up to minus 90 millivolt. When this minus 90 millivolt is called hyperpolarization. At this moment, the sodium leaky channel open and bring sodium inside the cell and repolarize the inside of the cell to minus 70 millivolt. When repolarization of the cell occur, the hyperpolarization, and this hyperpolarization is due to the excessive loss of potassium from the intracellular fluid, and then this hyperpolarization is stabilized by the sodium leaky channel. Thank you. Please subscribe the channel and press the bell icon for upcoming notification.